Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Stephen Newmark, Chief of Policy at the Global Healthy Living Foundation.
And I'm Zoe Rothblatt, Director of Community Outreach at GHLF.
Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life.
And Stephen, it's been a while since we've done a check-in on the latest and greatest with viruses roaming our nation.
Yeah.
So we thought this would be a good time for a midsummer check-in to see where we're at.
Yeah, excellent. We'll also discuss the latest vaccine news and how you can keep safe for the rest of the summer and into fall. So let's get into it.
Yeah, so I guess just to level set before we dive into the specifics, it's always helpful to say that things are better now, summer 2024, than each of the previous summers, especially better than summer 2020. So I'm grateful for that.
Absolutely. So I feel like that's a caveat to the entire production here today. All the negativity we were about to put into the ether. It's better than it was.
Let's say you're supposed to sandwich bad news or feedback with two bits of good news. So that was me sandwiching. We'll wait
There
to
you
see
go.
your bottom half of the sandwich. Yeah.
Yeah, let's see it.
So COVID.
All right. Well, on a downer, COVID cases are once again rising across the country. Of course, they're rising in relation to the low levels that we've become accustomed to. Positive tests, emergency department visits, hospitalization, the main markers that the CDC uses to gauge virus activity are all rising, especially in seniors and especially in Western states.
This is a pattern, though, that we've seen traditionally in the summer in the U.S. every year, especially around July 4th travel. So it's not too surprising. And like you mentioned, it's while case rates are rising, it's still a low level because it's in relation to the low level that we've been seeing. So it's not at a scary point.
Yeah, I just want to note that Hawaii in particular is showing high levels of COVID-19. So to our friends on the islands, we ask that you stay safe.
Yeah, shout out Hawaii. Stay safe out there.
And there are some new subvariants. We've all become mini virology experts at this point. We know that viruses mutate, and Omicron is continuing to do so itself.
Yeah, and it's hard to keep track of all these names. I guess the biggest point to make about the subvariant is just that experts are closely monitoring it so that we can tailor the vaccine to be most effective towards the newest variants.
Right. You mentioned July 4th travel, but the spread is possibly also caused by the heat. It's kind of like the reverse of what we deal with in the winter. It's been so gosh darn hot out this summer that many folks are hanging out inside for the air conditioning. So, of course, viruses spread more easily indoors, which is why we often see a spike in infections, as I mentioned, in the winters when folks head indoors to avoid the cold. So they're doing a lot of that now to avoid the heat.
Right. Who wants to do a picnic outside in 92 degrees with humidity when you can sit in the nice AC?
Totally. Who wants to go out and get the mail even? Jeez.
Yeah.
It's absurd out there.
But unfortunately, that makes it hard for social distancing or extra precautions that you're afforded outside versus inside.
Totally. I mentioned Hawaii earlier. Hawaii had a small COVID wave this past winter, which likely means less immunity for its residents, and that could be a factor in why COVID has just been spreading more easily over there. Will this continue to grow? Who knows?
And I'm not sure if you know this, but also is it more challenging to get a vaccine over there just by nature of travel from some of the islands to healthcare places?
That's a great question that I do not know the answer to. Let's put a pin in that and get an answer before we get to the end of our show. Maybe, if not, we'll get an answer for our next show. I don't know the answer to that. I mean, obviously, it goes without saying that anywhere in the world, anywhere in the United States, the more remote location you're in, the less access you have generally to healthcare and then healthcare facilities. So yes, that stands to reason that if you're in certain islands, you're going to have less access generally.
Yeah, which could contribute then to the less immunity. Like you said, there was a smaller wave the past winter, and then also just by nature of access to vaccines.
Yeah, absolutely. And just as a reminder, as you mentioned, I think the FDA is recommending an updated formula to target these newer mutations, and we'll find out what's coming vis-a-vis new vaccines for the fall in the coming weeks, and we'll be sure to keep everyone updated. Hopefully a formula targeting the current mutations will be made available soon.
Yeah, that's exciting. And I think we mentioned in a previous episode that they're working on a combined shot flu and COVID. It won't be available for this season, but I feel like that's still on my mind as we hear about more vaccine news to keep learning more about that too, because that would be fun.
Yeah, that would be great. All right. Well, The mpox, it's still around. Monkeypox cases in New York City, for example, are 4 times higher than they were last year. However, that's still lower than it was in 2022.
And I guess the good news is that the US has a less severe strain that's dominant, so I guess it's just like not such an active threat, per my professional opinion as an advocate.
Yeah, exactly. Moving on, norovirus cases are increasing. And norovirus, very important, can be stopped with hand washing. So make sure you're doing that.
Yeah, this is an ugly stomach bug that can really take a toll on you, and it is not fun. So definitely hand washing is greater than spending your night or few days in the bathroom.
Definitely. Pertussis or whooping cough is increasing in pockets of the country like Kentucky and Delaware. Over in England, cases reached a record-breaking level recently of whooping cough. This is preventable with the Tdap vaccine, so be sure to get that Tdap vaccine every 10 years.
Yeah, that's a good public health call-out reminder. Like, check your vaccine records. I was due for it recently and just like kind of came across that by accident, but good to stay on top of.
Yeah, you don't want to get whooping cough. This isn't the 1800s.
No, especially when you're immunocompromised, I feel like I would feel quite lousy.
Totally. Measles has been detected in New York City. Vaccinations against measles offer a high degree of protection. 2 doses of the combined measles, mumps, and rubella, the MMR vaccine, are 97% effective. So just like we said with the Tdap for whooping cough, make sure you're up to date on your MMR vaccines as well.
Yeah, I guess the bottom line with all of these is like there are viruses circulating, like to some extent they're circulating to a normal level. Like norovirus comes, I think like it has a peak season every year. Measles, like vaccines are so effective, like it shouldn't really be spreading, and we've seen it quiet for a long time, but it does pop up in communities. But just it's a really good idea to be like talking to your doctor about what's going around and make sure that you're up to date on all of your vaccinations.
Absolutely. One illness that does not have a vaccination is bird flu, or at least doesn't have one publicly available, is bird flu. A few more poultry workers in Colorado have tested positive. All the cases are mild. Health officials continue to characterize this threat to the general public as low. And the virus, as far as is known, has not spread from person to person. It's only spread from animal to human, not human to human.
So, yeah, that's good news. And then I guess not necessarily like a virus, but just think about the heat, like what you mentioned before, where I think most of the country is experiencing a heat wave. It's really important to think about health in a time like this because some of your medications can lead you to be more dehydrated, can cause higher sensitivity to sun, so you can get sunburned much easier than you would have otherwise, or just make it harder for you to stay cool or contribute to you feeling lightheaded. So just double check with your doctor on what medications you're taking and how to, just like stay hydrated and cool and healthy during this heat.
Yeah, excuse my language, it totally sucks, this heat. In June, we were getting emails or I was getting notifications on my phone, like unprecedented heat. It's June. I'm like, June is now part of the summer, unfortunately. The summer is like forever now. This particular week that we're recording, this is like the 5th week in a row that I'm getting alerts on my phone. Oh, the heat wave is going to be extended another day. The heat wave is going to be extended another 2 days. The heat wave is going to be, I'm like, it's not a heat wave. That's the temperature. That's the weather. It's the summer.
It's true, yeah.
Unfortunately, we just have to deal with it. There's no other way around it.
Yeah, it's like it's not a wave. Speaking of all the viruses, like makes me reminiscent of Flatten the Curve in 2 weeks. Like, okay, the heat wave, just another day. And it's like, guys, this is happening. Like, we have to just admit it.
Right. First of all, it's not just July and August. It's June, July, August, September for now. Someday it'll probably extend into May and October as well. But yeah, and it's everywhere. I don't know. Maybe we should move to Greenland or something. But until then, we're going to have to stay hydrated, as you said. Stay cool, stay hydrated as best you can. And definitely understand that it does cause lightheadedness and it's not fun to get heat stroke. It's not fun to even just be out in the heat for extended periods of time.
Yeah, I think it's one of those that like seems so obvious. Like, oh, you've experienced the summer every year you've been alive. Of course, you know how to handle the heat, but it can really sneak up on you.
Totally.
Especially when you live with underlying illness.
Yeah, absolutely. It affects your decision making too. I read a study about how it affects your decision making. I read another study how it actually reduces your IQ points by being out in the heat for prolonged periods of time. So if you're not playing with your 100% self when you're out there for too long.
Well, turning to our final bit of news, there was a recent ACIP meeting. That's the committee for the CDC that reviews the vaccine data and makes recommendations. And like you mentioned at the top of the episode, there's still determinations for the COVID vaccine. We don't have the new formula yet, but they agreed that everyone 6 months and up should get the COVID and flu vaccines this year, and that for COVID, they should target the new variants of this JN1 lineage.
Yeah, they also simplified recommendations for RSV, respiratory syncytial. I can't pronounce it. Can you pronounce it, Zoe? Come on. Syncytial virus. Well, whatever. RSV.
Yeah.
The RSV vaccine. They now recommend all adults 75 years of age and older to receive a single dose. Adults 60 to 74 should get a single dose of RSV vaccine if they're at increased risk of severe disease. And adults 60 to 74 are at higher risk if they have certain chronic medical conditions such as lung or heart disease, or if they live in a nursing home or long-term care facility.
And the last bit of vaccine news from this meeting was that there's a new pneumococcal vaccine recommended. So this is a new 21-valent pneumococcal conjugate vaccine. So the abbreviation is PCV21, and it's now an option for adults age 19 and older. And basically what that just means is that it includes some newer strains that are not contained in the current vaccine, and then it also no longer contains certain subvariants that are no longer circulating. So really just an update.
Excellent. Well, so the bottom line is there are things out there that could keep you up at night if you want. But of course, there are steps we can all take to live our best lives. Get vaccinated, wash your hands, take extra precautions as necessary when local cases spike, and stay cool and hydrated to prevent heat-related illnesses.
Great job packaging the positivity.
Yeah,
there we go.
there you go.
Lots
Boom.
of public health measures to stay positive.
Absolutely.
Well, I think you know my next question. What'd you learn today?
There's a lot out there, but nothing that really should keep you up at night is what I would say. That's the learning.
Yeah, and I learned from you a little bit more about what's going on in Hawaii.
Well, we hope that you learned something too. And before we go, we want to encourage everyone to check out all of our podcasts at ghlf.org/listen.
Well, everyone, thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you like this episode, give us a rating, write a review, and hit that subscribe button wherever you listen. I'm Zoe Rothblatt.
I'm Stephen Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.